Hi, my name is Tate Johnson. So I grew up in North Bend, Nebraska. It's a small town, not too far from Omaha. I went down to the University of Nebraska for my undergrad, and since then I've been at UNMC. So I did my medical school here, internal medicine residency. I did a year as a chief resident before completing my rheumatology training here at UNMC. I think really drew me to medicine as a field was this ability to blend my academic interests into a career of service to others. And so, getting to work closely with patients through oftentimes really challenging periods of time in their lives is really a privilege and was a great fit for me, and been happy with the career choice. So rheumatology, it's really the best of many fields to me. So it's cognitively a challenging field. Our conditions oftentimes affect, basically any body system. And so we're presented with really complicated clinical scenarios and have to use the breadth of our internal medicine training to sort of sort these things out. Oftentimes rheumatic diseases will affect quality of life for patients, whether it's joint pain or weakness or things like that. And with treatment advances over the last couple of decades, we can really make a tremendous impact in patients' lives. And in addition, we get to follow our patients longitudinally, so I get to get to know patients really well. I'm seeing them several times a year, so it makes for a really fulfilling career. The most common conditions I treat fall under this umbrella of inflammatory arthritis. So that includes things like rheumatoid arthritis, gout, psoriatic arthritis, and the inflammatory arthritis conditions is where I have a particular clinical and research interest. But I also oftentimes I'm taking care of patients with more rare conditions such as lupus, myositis, vasculitis, or other rare connective tissue disorders. From an early stage, I knew I wanted to go into academic medicine. I went to the Nebraska Medical Center for medical school, and I've stayed here since. I always really liked the idea of, in addition to taking care of patients, being able to teach and mentor medical trainees, as well as perform clinical and translational research to contribute to the field. And so Nebraska Medicine's been a great institution and environment to facilitate all those goals in my career. But in addition, the people here are just great. And so that's what's kept me around, is the people I work with and also the communities we serve. So I grew up in a small town nearby Omaha, and getting to serve Omaha and the surrounding communities has really been a great rewarding experience for me. So when not practicing medicine, I love spending lots of time with my wife and two kiddos at home. We love to travel, see the country when we have time to, and really do anything we can to get outdoors. Most frequently that means I'm working on perfecting my lawn, but when I ideally have time, I'm hiking, fishing, trying to pursue one of my few bucket list items of climbing all the 14,000-foot peaks in Colorado.